clean. Let's take this off there because you don't need there. We'll see how we go. Thanks, Sweetheart.
So is that just witch hazel you're using now?
This is witch hazel, yeah. He's got quite a sensitive skin.
Yep.
Yeah, you're a sensitive little thing. Look at you.
Oh,
Yeah, you've gone all pink when we're rubbing. We obviously have to treat you gently.
I think because I shaved yesterday.
Did you shave yourself? Okay.
And with your Chlorhex and witch hazel, is it like a 50-50 mix that you just...
Well, witch hazel's quite nice, excuse me, on the skin because it's a natural antiseptic.
Yeah.
Okay, so I don't then, just because I've marked, but I'll generally try and take all the pen off just because I don't want a little blob of it on the end of my needle.
Yeah.
Okay, so take the cap off, balance your syringe, and then what I want is I want bevel up.
All right.
Yeah, so you can see I'm bevel up there,
Yeah.
and then prime your needle. Okay, and then to get rid of that blob, you just shake it. Don't wipe it.
Yeah, because it's not sterile.
Yeah.
Mm.
Okay, so what we need to do here is have a look. And we know that this is probably the least problematic. So I'm just going to, when I'm doing this, can you see where, that's where I'm starting to get the natural crease there. So I'm going to start here. Okay, Leo, show sharp scratch. And men's skin, as I say, is a lot thicker. So you just gently advance it. You all right, my love? I'm sorry. Even with local anaesthetic being around your nose, it's actually quite uncomfortable.
Yeah.
Okay, my love, and then actually start injecting. Now, you need a degree of pressure on the plunger. Can you see how the skin's starting to come up?
Yeah. Yeah.
And then you just gently withdraw your
And
needle
then you
out.
withdraw.
Yeah.
And as you're withdrawing, are you...
And then as you come, just before you get to the end, you take your needle out, and then you feel. You all right, my darling? Has that brought tears to your eyes? Okay, and you can actually feel the filler. Do you want to put some gloves on,
Yeah,
ladies?
that's okay. Do you want to pass a couple over? So small.
You're all right. Do you want a tissue for your eyes?
Yeah.
See if we can find a tissue. I'm bringing tears to this poor man's eyes.
Yeah.
Is there any tissues in the bottom? Or any...
Have that to begin with. Let's see if we can find some...
Sorry.
It's all right.
Make you cry.
Okay, no worries.
You're all right now.
Yeah, it's all right.
Do you mind if I have a feel? Is that okay?
Of course, yeah.
Can you feel the product?
So it's quite firm.
Yeah, that's what I need.
And that's what it will stay. Does it know?
No, that'll soften. But
Fine.
that can you feel the edge of your filler?
Yes.
Yeah. Okay.
Yeah,
So if you can't feel that, then you've not put enough in.
fine.
Obviously.
Okay, that's good.
Yeah.
So that almost be like the step-by-step approach where
Yeah.
you told us as you come
Yeah,
out,
yeah.
you...
Okay. So I know the end of my bit there. Right. Sharp scratch, Leo. Sorry, darling.
Yeah.
Okay. And I'm coming to there. I know it's very sensitive. So my tip right by the nostril there, and it is uncomfortable because we know
Really
we're
well
quite
done,
sensitive. Okay. And then as I inject, I can see it coming up.
Do you tend to always start
Stop.
inferiorly and then work?
Yeah, I'll tell you the reason why in a minute. Let me just do this
Do you get a bit of diffusion?
Okay, so this is the
a
fanning.
little bit. This is my fanning technique. So can you see there? With your last end point being lateral to that nostril. Okay, sorry, sweetheart.
No worries, no, it's all right.
Oh God, I'm going to be...
No pain, no gain, Leo.
Yeah, no.
No pain, no
I
gain.
know.
All right? And what you can see is what I've done is I've got to a little bit of correction there, but bless him.
You're doing
No,
very well.
He is.
And the light's bright as well, which doesn't help.
Okay. And recognising that actually this is going to improve.
Yeah.
Yeah, and then just gently dab it.
So it's that under correction. You don't need to sort of massage it. You just leave
No,
it in
no,
place.
no. This is the one thing about this filler is that you don't need to massage.
And that's because the texture is not heavy.
It's soft. It's
Yeah.
beautiful. I mean, you can feel it there. Okay, now I've just undercorrected there. You all right, my love?
Yeah, I'm okay. No worries.
Shame. Not nice. Okay. And then I just move to the other side.
Yep. You shift round. You right if I stand here?
Yeah, of course, darling.
No, I can't see.
Well, okay.
Why see? Yesterday was tricky with 8 of us trying to.
Oh,
right,
God.
no,
That must have been interesting.
I wouldn't do that. I'd really
It was a lot.
All right, my sweetheart. Now we know that this side is the one that he is bothered the most. Now the reason why we start at the bottom and work up is that if you start at the top, if I started there, with that second one, if I went there and I went there, as soon as I'd injected, it'd start coming out the hole.
So sorry, say that again.
If I start there,
Yep.
yeah, I've got a hole there.
Yeah.
So if I go to there,
It's going to squirt straight out the top. So
Mm.
I start inferiorly.
yeah,
So you're keeping your injection points away from your
yeah,
Filler.
yeah. You're all right, sweetheart. I am worried.
I'll survive
I
otherwise.
don't like causing pain. I hate it.
No, it's okay.
Okay, so we know here, so we're not going to need too much, but we know that this is an area here that Leo doesn't like. Okay, so sharp scratch, my love. Okay, see my outline on the middle? You see as it starts to come up? You don't need much, because I'm trying to. Can you see that little tethering at the right at the end of my
Yeah.
needle?
Yeah.
I've gone a little bit too superficial. You see, so as soon as I flatten it, I've got that little dent just there.
Yeah.
Yes, what I need to do is just move and change my angle.
Yeah.
That's,
Okay.
Yeah?
that's
Because too
interesting.
superficial there, I'm going to get that little blob of filler coming
Yeah.
up and we'll get a tyndall. And what you're looking for, I don't look to see how much I'm giving, I'm watching the skin come up.
Okay.
To make sure you're
And you
filling.
can see that. You don't even, it's not going to be huge. How are you, sweetheart? You all right?
Yeah.
Okay, sharp scratch coming now. Okay, so that's one
Wow.
scratch. So we can do that, and then we need to do the other one.
It's almost like an immediate difference already.
Hmm.
Yeah, yeah. And this will get better,
Mm.
you know, in the next couple of days. I'm using a thicker one on you, Leo, because you're a roughy, toughy man.
Good. Yes.
I feel bad doing this to my mum.
Pardon?
I don't feel bad doing this to my mum. I don't really like hurting people particularly.
Well, hopefully she's going to put it in though.
Oh yeah, I did tell her to put plenty on.
And, yeah, that should be easier.
Yeah.
Okay, so we just got on to the next one. So again, same
So
principle.
far I had a mill.
Yeah.
Yep.
You're right. Okay. And you also, when you're doing that, you're finding this where, you know, if there aren't any little holes. So we've gone to there. Right, sharp scratch coming out there. It'll bring tears to your eyes. Good chap, good chap. Try not to. Being brave. Brilliant, 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 brilliant. Okay, so I've come to almost out, change my angle, and I'm fanning now. Try and advance this needle really slowly when you come into the nose, just because it's, no matter how much local you've got,
Very sensitive.
really sensitive, really sensitive. Well done, sweetheart. Oh, don't like that. Sorry, sweetheart. Hold on.
And as you're going, sort of what level are you going at here? Is this sort of deeper?
Yeah.
So you're angling at what, sort of 45 degrees?
About 30.
About 30 for this
Yeah.
one?
No, I don't want to go 45 because I'm too deep.
Okay,
You see they've got slight blanching in the skin there?
Yeah.
Well done. Okay.
Does this contain local? 0.3%? No.
That's what it's crying. Right, I think that's enough. We don't need to do any more there. Okay, now Leo, we've got a little bit left on the syringe, so can I put it here by your mouth where I said to lift?
Yes.
Is that okay? Just that, you know, you're paying for it, so I might as well give it to you. Or I can put it here on your chin. Where would you prefer?
I think in the chin.
Shall I put it there? Yeah, okay. So with this one on the chin, what we're trying to do is that you know, with ageing, what we've got, you can see the migration here, development of this jowling, yeah? Okay, which is what they don't like. So, of course, can you see there when I do that? That's where we've got the volume loss. So, essentially, with this, what we're trying to do is create an illusion of a smooth contour. So, what you do is you find the angle of the jaw, yeah? And where that sulcus is, sharp scratch coming earlier, well done.
And quite flat, sort of 10 degrees.
Almost, yeah, because literally I'm going to be almost on bone if I go any deeper.
Yeah,
I
very
just want-
superficial.
yeah, okay. Okay, so it's one line on the angle of the jaw, and then I'm going to put one just on top here. Okay, sharp scratch here. This is probably better compared to up by your nose. Okay, turn towards me here. And then what we do here, just is I just press it, just to make sure I'm nice and flat. Beautiful. Look at that.
Yeah.
Oh, it does look better, doesn't
Look,
it?
and you see when I do this,
Yeah.
no creasing, and that will get better. There you go, my sweetheart. I've
Yeah.
got that much left. Can I put it by your lip now?
Yeah, you can.
Thank you.
Go ahead.
Don't
No
waste
worries. You can do that. No worries.
Absolutely, don't want to waste them.
I'm just going to get behind you. So
Yes.
just got places to hold. Thank you. Okay. Right, now this is another one that's going to make you cry, and I'm really sorry.
That's all right.
I'm sorry. Okay, so what I'm trying to do is just lift the side of the mouth.
Okay.
Yeah? So I'm literally running. Pull it slightly. Sharp scratch. I'm running almost along that vermilion border there. And turn. And then go down again.
So we're saying a fanning technique here.
Almost, but I'm only doing 2 fans. I'm literally running 2 lines of thread.
Ah,
like that.
fine.
Okay, hold on. Can I just put that down there just so that it's sliding in? Right, my love, open your mouth for me a sec. And then all I do is just ever so gently, because it's quite thick, ever so gently, just to flatten, so he doesn't feel like it's got a big lump in his mouth there.
Yeah.
Now, it might feel slightly lumpy there, just for a couple of hours, but that'll all settle. That's perfect. You're done now, my love. You can close your mouth. Close your mouth. But look at that.